Don't read NCERT. Listen it, feel it. हेलो फ्यूचर डॉक्टर्स, माय नेम इज़ कीर्ति और मैं आपको हर क्लास में NCERT लाइन बाय लाइन पढ़ाती हूँ। अगर आप इस चैनल पर नए हैं तो सब्सक्राइब करना ना भूलना और बेल आइकन भी प्रेस कर देना, जिससे हमारे आने वाले हर वीडियो की नोटिफिकेशन आपको मिलती रहेगी। तो आइए बिना टाइम वेस्ट किए स्टार्ट करते हैं। आज की क्लास में हम पढ़ने वाले हैं रिप्रोडक्टिव हेल्थ। तो आइए स्टार्ट करते हैं। You have learned about human reproductive system and its function in chapter 3. Now, let's discuss a closely related topic, reproductive health. What do we understand by this term? The term simply refers to healthy reproductive organs with normal functions. However, it has a broad perspective and includes the emotional and social aspect of reproduction also. According to the World Health Organization, WHO, reproductive health means a total well-being in all aspects reproduction, physical, emotional, behavioral and social. Therefore, a society with people having physically and functionally normal reproductive organ and normal emotional and behavioral interaction among them in all sex-related aspects might be called reproductive healthy. Why is it significant to maintain reproductive health and what are the methods taken up to achieve it? Let's examine them. 3.1 Reproductive health problem and strategy. India was amongst the first country in the world to initiate action plan and program at a national level to attain total reproductive health as a social goal. This program, called family planning, were initiated in 1951 and were periodically assessed over the past decade. Improved program covering wider reproduction related areas are currently in the operation under the popular name Reproductive and Child Healthcare RCH programs, creating awareness among people about various reproduction related aspects and providing facilities and support for building up reproductively healthy society are the major tasks under these programs. With the help of audiovisual and print media, governmental and non-governmental agencies have taken various steps to create awareness among the people about reproduction related aspects. Parents, other close relatives, teachers and friends also have a major role in the above information. Introduction of sex education in school should also be encouraged to provide right information to the young so as to discourage children from believing in myth and misconception about sex related aspect. Proper information about reproductive organs, adultness and related chains, safe and hygiene sexual practice, sexual transmitted diseases, STDs, AIDS, etc. would help people, especially those in the adolescent age group, to lead a reproductively healthy life. Educating people, especially fertile couple and those in marriageable age group, about available birth control options, care of pregnant mother, postnatal care of the mother and child, importance of breastfeeding, equal opportunity for the male and the female child, etc. would address the importance of bringing up social consciousness, healthy families of desired size, awareness of problems due to uncontrolled population growth, social evils like sex abuse and sex related crimes, etc. need to be created to enable people to think and take up necessary steps to prevent them and thereby build up a socially responsible and healthy society. Successful implementation of various action plans to attain reproductive health requires strong infrastructural facilities, professional expertise and maternal support. These are essential to provide medical assistance and care to people in reproduction related problems like pregnancy, delivery, STD, abortion, menstrual problems, infertility, etc. Implantation of better techniques and new strategy from time to time are also required to provide more efficient care and assistance to people. Ban on amniocentesis for sex determination to legally check increased menace of female feticide. Massive child immunization, etc. are some programs that are mentioned in the concessions. In amniocentesis, some of the amniotic fluid of the developing fetus is taken to analyze the fetal cell and dissolve substance. This produce is used to test for the presence of certain genetic disorder such as Down syndrome, hemophilia, sickle cell anemia, etc. Determine the survivability of the fetus. Research on various reproduction related areas are encouraged and supported by governmental and non-governmental agencies to find out new method and or to improve upon the exist one. Do you know that Saheli, a new oral contraceptive for the female, was developed by scientists at Central Drug Research Institute CDRI in Lucknow, India. Better awareness about sex related matters, increased number of medical assistance levies, and better postnatal care leading to decreased maternal and infant mortality rate, increased number of couples with small families, better detection and cure of STDs and oral increased medical facilities for all sex related problems, etc. All indicate improved reproductive health of the society. 3.2 Population stabilization and birth control. In the last centuries, an all-around development in various fields significantly improved the quality of the life of the people. However, increased health facilities along the better living condition and had an explosive impact on the growth of the population. The world population, which was around 2 billion, 200 million in 19,000 to about 6 billion by 2000 and 7.2 billion in 2011. A similar trend was observed in India too. Our population, which was approximately 350 million at the time of our independence, reached close to the billion mark by 2000 and crossed the 1.2 billion in May 2011. A rapid decline in death rate, maternal mortality rate (MMR) and infant mortality rate (IMR), as well as increase in the number of people in age problem probable reason for this. Through our reproductive child health RCH program, though we could bring down the population growth rate, it was only marginal. According to 2011 census report, the population growth rate was less than 2%. 20 per 1000 per year, a rate at which our population could increase rapidly. Such an alarming growth rate could lead to an absolute of even the basic requirement food, shelter, and clothing, in spite of significant progress made in those areas. Therefore, the government was forced to take up the serious measure to check this population growth rate. The most important step to overcome this problem is to motivate smaller families by using various contraceptive methods. You might have seen advertisement in the media as well as poster bills, etc. Showing a happy couple with two children with the slogan "Hum do hamare do, we two our two." Many couple, mostly the young urban working ones, have even adopted an one-child norm census raising of marriageable age of the female to 18 years and that of male 21 years and incentives given to couples with small families are two of the other measures taken to tackle these problems. Let us describe some of the commonly used contraceptive methods which help prevent unwanted pregnancies. An ideal contraceptive should be user friendly, easily available, effective, and reversible with no early side effects. It should be no way interfere with sexual drive, desire, and or the sexual act of the users. A wide range of contraceptive methods are presently available which could be broadly grouped into the following categories, namely natural and traditional, barrier, IUDs, oral contraceptive, injectables, implants, and surgical methods. Natural method work on the principle of avoiding chance of ovum and sperm meeting. Periodic abstinence is one such method in which the couple avoid to abstain from coitus from day 10 to 17 of the menstrual cycle when ovulation could be expected. The chance of fertilization are very high during this period. It is called the fertile period. Therefore, by the abstaining from coitus during this period, conceptions could be prevented. Withdrawal or coitus interruptus is another method in which the male partner withdraws penis from the vagina just before ejaculation so as to avoid insemination. Lactational amenorrhea, absence of menstruation. Method is based on the fact that ovulation and therefore the cycle do not occur during this period of instant lactation following parturition. Therefore, as long as the mother breastfeeding the child fully, chance of conception are almost nil. However, this method has been reported to be effective only up to a maximum period of 6 months following parturition, as no medicine or device are used in these periods. Side effects are almost nil. Chance of failure through this method are also high. In barrier methods, ovum and sperm are prevented from physically meeting with the help of barrier. Such methods are available for both males and females. Condoms are barrier made up of thin rubber latex sheet that are used to cover the penis in the male or vagina and cervix in the female just before coitus so that the ejaculated semen would not enter into the female reproductive tract. This can prevent conceptions. Nirod is a popular brand of condom for the male. Use of condom has increased in recent years due to its additional benefit of protecting the user from contracting STI and AIDS. Both the male and the female condoms are disposable, can be self-inserted and thereby device privacy to the users. Diaphragm and cervical caps and walls are also barrier made of rubber that are inserted into the female reproductive tract to cover the cervix during coitus. They prevent conception by blocking the entry of sperm through the cervix. They are reusable. Spermicidal creams, jellies, and foams are usually used along this barrier to increase their contraceptive efficiency. Another effective and popular method is use of intrauterine device IUD. These devices are inserted by doctor or expert nurses in the uterus through vagina. These intrauterine devices are presently available as the non-medicated IUD, lip slow, copper releasing IUDs, CUT, CU7, multilode 375 and the hormone releasing IUDs, progesterone, LNG20 IUDs increase phagocytosis of sperm within the uterus and the Cu ion, copper ion released suppress sperm motility and the fertilizing capacity of sperm. The hormone releasing IUDs in addition make the uterus unsuitable for implantation and the cervix hostile to the sperm. IUDs are ideal contraceptive for the females who want to delay pregnancy and or space children. It is one of the most widely accepted method of contraception in India. Oral administration of small dose of either progesterone or progestogen or estrogen combination is another contraceptive method used by the females. They are used in the form of tablets and hence are popularly called the pills. Pills have to be taken daily for periods of 21 days starting preferably within the first 5 days of menstrual cycle. After a gap of 7 days during which menstruation occurs, it has to be repeated in the some patterns till the female desire to prevent conception. They inhibit ovulation and implantation as well as alter the quality of cervical mucus to prevent retarded entry of sperm. Pills are very high effective with lesser side effect and are well expected by the females. Saheli, the new oral contraceptive for the females contain a non-steroidal preparation. It is once a week pills with very few side effects and high contraceptive values. Progestogens alone or in a combination with estrogen, can also be used by female as injection or implant under the skin. Their made up of action is similar that the of pills, and their effective periods are much longer. Administration of progestogens or progestogen estrogen combination or IUDs within 72 hours of coitus have been found to be very effective as emergency contraceptive, as they could be used to avoid possible pregnancy due to rape or casual unprotected intercourse. Surgical methods are also called sterilization, are generally advised for the male and the female partners as a terminal method to prevent any more pregnancies. Surgical intervention blocks gamete transport and thereby prevent conception. Sterilization produced in the male is called vasectomy and that in the female tubectomy. And vasectomy, a small part of the vas deferens is removed or tied up through a small incision on the scrotum. Whereas in the tubectomy, a small part of the fallopian tube is removed or tied up through a small incision in the abdomen or through vagina. These techniques are highly effective, but their reversibility is very poor. It's need to be emphasized that the selection of suitable contraceptive methods and its use should be always be undertaken in consultation with qualified medical professionals. One must also remember that contraceptives are not regular requirement for the maintenance or reproductive health. In fact, they are practiced against a natural reproductive event, conception pregnancies. One is forced to use this method either to prevent pregnancy or to delay or space pregnancy due to professional personal reasons. No doubt, the widespread use of this method have a significant role in checking uncontrolled growth of population. However, this possible will affect like abdominal pain, breakthrough bleeding, irregular menstrual bleeding, or even breast cancer, though not very significant, should not be totally ignored. 3.3 Medical termination of pregnancy MTP. Intentional or voluntary termination of pregnancy before full term is called medical termination of pregnancy MTP or induced abortion. Nearly 45 to 50 million MTPs are performed in a year all over the world, which account to 1 by 5th of the total number of conceived pregnancy in a year. Whether to expect or legalize the MTP or not is being dependent upon in many countries due to the emotional, ethical, religious and social issues involved in it. Government of India legalized the MTP in 1971 with some restricted condition to avoid its misuse. Such restrictions are all the more important to check and illegal female feticide which are reported to be high in India. Why MTP? Obviously, the answer is to get rid of unwanted pregnancy either due to the casual unprotected intercourse or failure of the contraceptive use during coitus or rapes. MTP are also essential in certain cases where continuance of the pregnancy could be harmful of even fetal either or the mother or to the fetal or both. MTPs are considered relatively safe during the first trimester up to 12 weeks of pregnancy. Second trimester abortion are much more riskier. One disturbing trend observed in that a majority of the MTP are performed illegally by unqualified quacks which are not only unsafe but could be fatal too. Another dangerous trend in the misuse of amniocentesis to determine the sex of the unborn child. Frequently, if the fetus is found to the female, it is followed by MTP. This is totally against what is legal. Such practice should be avoided because these are dangerous both for the young mother and the fetus. Effective counseling on the need to avoid unprotected coitus and the risk factor involved in illegal abortion as well as providing more health care facilities could reverse the mentioned unhealthy trend. 3.4 Sexual transmitted infections STI infections or diseases which are transmitted through sexual intercourse are collectively called sexual transmitted infections STI or mineral disease VD or reproductive tract infection RTI. Gonorrhea, genital herpes, gonorrhea, chlamydia, genital wart, hepatitis B, and of course, the most discussed infection in the recent year, HIV leading, and to AIDS are some of the common STIs. Among these, HIV infection is most dangerous and is discussed in detail in chapter 7. Some of these infections like hepatitis B and HIV can also be transmitted by sharing of injection needle, surgical instrument, etc. with infected person, transfusion of blood or from an infected mother to the fetus too. As expect for hepatitis B, genital herpes and HIV infection, other diseases are completely curable if detected earlier and treat properly. Earlier symptoms of most of these are minor and include itching, fluid discharge, slightly pain, swelling, etc. In the genital region, infected female may often be asymptomatic and hence may remain undetected for long absence or less significant symptom in the earlier stage of the infection and social stigma attached to the STI deter the infected person from going for timely detection and proper treatment. This could lead to complications later, which include pelvic inflammatory diseases, PID, abortion, stillbirth, ectopic pregnancy, infertility, or even cancer of the reproductive tract. STI are a major threat to healthy society. Therefore, prevention or earlier detection and cure of this disease are given prime under the reproductive health care programs. Though all persons are vulnerable to this infection, their incidence are reported to be very high among persons in age of 15 to 24 years, the age group to which you also belong. There is no reason to panic because prevention is possible. One could be free of this infection by following the simple principle given below. First, avoid sex with unknown partners and multiple partners. Second, always try to use condom during coitus. Third, in case of doubt, one should go to a qualified doctor for early detection and get completely treatment if diagnosed with infection. 3.5 Infertility. A discussion on reproductive health is incomplete without a mention of infertility. A large number of couples all over the world, including India's, are infertile. They are unable to produce child of in spite of unprotected sexual cohabitation. This reason for this could be many physical, congenital disease, drugs, immunological, or even physiological in India. Often the female is blamed for the couple being childless, but more often than not, the problem lies in the male partners, specialized healthcare units, infertility clinics, etc. could help in diagnostic and corrective treatment of some of these disorders or enable this couple to have a child. However, where such correction are not possible, the couples could be assisted to have a children through certain special techniques commonly known as assisted reproductive techniques ART. In vitro fertilization, IVF fertilization outside the body in almost similar condition as that in the body, followed by embryo transfer ET. In one of such methods, in these methods properly known as test tube baby programs, ova from the wife, donor females, and sperm from the husband or donor males are collected and are induced to from zygote under the stimulated condition in the laboratory. The zygote or earlier embryo with up to 8 blastomeres could then be transferred into fallopian tube. ZIFT, zygote intrafallopian transfer. An embryo with more than 8 blastomeres into the uterus, IUT, intrauterine transfer. To complete in further development, embryo formed in vivo fertilization, fusion of gametes within the female also could be used for such transfer to assist those female who cannot conceive. Transfer of an ovum collected from a donor into the fallopian tube. Gift, gamete intrafallopian transfer of another female who cannot produce one but can provide suitable environment for fertilization and further development is another method. Intracytoplasmic sperm injection, ICSI, is another specialized produce to form an embryo in the laboratory in which a sperm is directly injected into the ovum. Infertility case either due to inability of the male partner to inseminate the male or due to very low sperm count in the ejaculated could be corrected by artificial insemination AI techniques. In these techniques, the semen collected either from the husband or a healthy donor is artificially introduced either into the vagina or into the uterus, IUT, intrauterine insemination of the female. Though options are many, all these techniques require extremely high precision handling by specialized professional and expensive instrument. Therefore, these facilities are presently available only in few centers in the country. Obviously, this benefits is affordable to only a limited number of people. Emotional, religious, and social factors are also determined in the adoption of this method. Since the unlimited aim of this produce is have two children. In India, we have so many orphaned and destitute children who have properly not survived till maturity unless take care of. Our laws permit legal adoption and it is at one of the best method for couple looking our parenthood. अगर आपको ये वीडियो समझ में आया तो चैनल को सब्सक्राइब करना ना भूलना और मिलते हैं नेक्स्ट सेक्शन में. बाय बाय.